Joining us in the studio today is Jordan Echols, an 04 graduate of ACU and JMC. Jordan is Digital Marketing Director.
I mean, you almost got it.
Oh, so Digital Marketing
So I am
Manager
the AVP of Digital Marketing for HCA Healthcare in Nashville.
for HCA Healthcare. HCA Healthcare is the largest hospital and healthcare provider in the country.
Correct. Yeah. In the healthcare delivery space, which would be hospitals, doctors' offices, urgent care, it's a very unique company. They're publicly traded. They're in the Fortune 100, and their scope and scale, the number of facilities and doctors they own, is really, there's really not anything else that's comparable to it.
And so Jordan was recipient last night of the Gutenberg Award from the Department of Journalism and Mass Communication. Congratulations
Thank you.
on that award. Well deserved. And one of the reasons that the faculty wanted to give you this award was in seeing how you responded to COVID in an industry that was so dramatically impacted by COVID.
Yeah.
And so I'd be interested in hearing you talk more about the impact of COVID on what you were doing professionally as a digital marketer.
Yeah. I think it was just an interesting time in general because we had dealt with crises in the past, but they were always very localized. You know, there would be a mass casualty event, there'd be a hurricane, and we were very good at our crisis response, but the idea of a crisis that impacted our entire enterprise, our entire footprint, was unheard of. And then you throw in the fact that while we're not only managing the crisis, we're also living in the crisis because you're worried about your own personal safety and health. Nobody knew what was going on. And then compound that with the fact that we were a 100% office-based culture. We didn't even have I probably shouldn't say this because it's my employer, but we didn't even really have a VPN structure that could support the entire workforce signing into it at the same time. And we went from being in the office one day to the mandate going down of we're shutting everything down, go remote, in the blink of an eye.
Well, it's an industry that is face-to-face.
Correct.
Historically, providing healthcare was such a relational face-to-face industry.
Yeah.
So I guess it makes sense.
And it did. And what we realized was, and this is where the marketing and communications part became so front and center, it was a time when we had to put information out there. And we weren't able to do it any other way but digitally. Nothing else had the speed that digital did. So one of the very first things we did in COVID was we sent an email to every single patient HCA had ever had. Millions and millions at scale, and my team helped operationalize that. Just to let them know that if they still had a medical emergency, they needed to come to the hospital. We weren't closed, but we were operating in a different way. And then as the pandemic progressed, we were using our websites, our social accounts to pass on key information about vaccines, about reopenings, about elective surgeries, and it just really showed the importance in the bigger healthcare delivery ecosystem that communications, marketing, and especially digital played.
Yeah. Describe your decision process about taking the job at HCA. You talked a little bit about this last night, but you had a job that you really liked in Texas.
I did.
And we've talked about this. I've done the same thing, moved to Nashville, take a job. Describe how you made that decision.
Well, it was difficult because I was in such a comfortable position in my previous role. And there was some little part of me that wanted to be pushed a little harder, that wanted to try, something a little bit different, but I wasn't actively looking. And then just things kind of fell together. Somebody I used to work with alerted me to the opportunity, and I really went into it thinking, I'm going to do this just for the interview experience because it's a huge company. I mean, how often do you get a chance to go interview with the, national leader in healthcare? And the whole time I was telling my family, I didn't even tell my parents. Yeah, I told my wife, I said, hey, I want to do this, see it through. And then the more I went through the process, and boy, they put you through the ringer. I mean, it was interview after interview. They flew me out to Nashville, and I think over the course of, one, 9 to 3 period, I interviewed with 6 or 7 different people, ran me all around the corporate office. And when I was done, I kind of left there thinking, wow, this is something that I've never seen before. The way that they view healthcare, the way they view marketing, the way that they look at things at such a bigger, higher level scale than anybody else does. But at the same time, I knew they were bringing in 4 or 5 other candidates for that final round, and I never had the thought that it would actually be a decision to reach. And then And then I got the call about a week later, and they said, hey, we want to offer you the job. And then things just kind of kicked into overdrive, because it went from this hypothetical, oh, this would be cool, to, hey, Mr. Echols, we need your decision pretty quickly here. We were ready to move on this. And like I mentioned, I hadn't talked to anybody really outside my immediate family. And I think my wife's first reaction was like, well, there's no way we can do this. Our parents, our siblings, our aunts, our uncles are all in Texas. We were comfortable. We had a really good life. We had a great church. But then we started to pray about it. And, I felt like my prayer was always the one that you would say for clarity, because I think I could kind of feel inside that I wanted to do it, but it wasn't just my decision, because I had a whole family to worry about. And the clarity really came through my wife. And she came to me a couple mornings later and said, I think we need to do it. And that was such a departure from anything that she had said prior to that. It just kind of seemingly was a God thing. And once we decided to do it, we were all in. And really, it's been 5 years now, and it's been the greatest thing, not only for our family, the opportunities that she's had, as well as myself, and the great people we've met along the way.
Yeah, that's great. So what things did you learn while you were a student at HCU that you're most able to put into practice in the kinds of things you're doing today?
Yeah, and I think it's funny, because you kind of have to balance like the two different things out, right? There was the technical skills I learned at HCU, which 20 years later, I don't think Quark Express exists anymore. And we were working on those big, bubble iMacs. But the things that I really learned were the way to think about things and the way to relate to people. And I've always said the relationship piece of it is the one that always goes, probably underreported. And I think that's the most important thing, because in your field, even when you're working at a big company, it's such a small ecosystem, and you run into the same people, and people remember how they treat you. They remember how you relate to you. And when you work in marketing, it's not even so much about understanding technically how marketing works and how marketing strategy works, because there's a lot of people that understand that, but it's how you explain it, how you can sell it, how you convince a executive leader, a hospital president, a doctor to go with the strategy that you've come up with. I remember I took Joyce Haley's class here, and one of the things she taught us was how to shake somebody's hand. And I know that sounds silly, but it always stuck with me. And I still think about that almost every time I shake somebody's hand to this day. And then I mentioned last night in the speech, working with Jeff War in the ad creative and copywriting class. He really taught me how to take constructive criticism. And when you work in marketing, so much of what you do, especially on the creative side, is subjective. And you have to be okay with somebody telling you they don't like what you did, or they don't agree with what you did, or being able to have a back and forth about something without you taking it personally, without reacting negatively. And I think those are the skills that I've really taken with me that have helped me be successful.
Yeah. So tell me about the spiritual piece. We want to be, as Christians, we want to be salt and light in the world. How does that play out in the industry that you're in?
Yeah. And it's interesting, because before I got to HCA, I was at Texas Health Resources, which was a faith-based deliverer of healthcare. And you kind of talk about the HCU bubble. There was definitely a Texas Health bubble too. I mean, we did, prayer before big meetings. We had chaplains and spiritual people on staff. And then I got to HCA, and it's a little bit different. And you have to be a little more out front with your faith there. But the great thing is the Nashville community is so steeped in the church, and you find that you get more comfortable talking about those things, and then you realize there are amazing Christian leaders everywhere you go, and being bold enough to talk about your faith makes other people comfortable talking about theirs. And I'm now involved on the board of an organization that helps pastors in Nashville through a contact I made at HCA. And literally the way that I found out about it was me asking if it was okay to pray over a meal. And then the guy afterwards kind of pulled me aside, and he said, hey, I thought that was really cool. I need to tell you about this organization I'm working with. And now I'm on the board for Operation Andrew Group in Nashville, which has a part of their thing called United for Pastors, which helps support pastors who are going through difficult time, with maybe their emotional or mental health. And something as simple as not being afraid to at least put a little feeler about your faith out there at work, opened a door to connect me to a really awesome organization.
Yeah, that's great. That's great. Well, my thanks to Jordan Echols, who is a 2023 Gutenberg recipient. My thanks to him for joining us in the studio today.